Hey everyone, it's Craig with One Man's Cancer Journey. Thanks for joining me again today. Hey, if you pray a lot, I'd ask you to keep two friends of ours in prayer this week. One is a childhood friend who I haven't seen in a long time, but my parents go to church with his parents, and we just learned that he was recently diagnosed with a tumor in his esophagus, and so he's having some testing done and kind of beginning his journey on the cancer journey. And the second would be for my brother's friend Dale. He has been battling cancer for the last 3 years. He's been struggling with this latest round. Even though they're aggressively fighting the cancer is continuing to spread. And so he has made a difficult decision to stop treatment at the end of April. And he has begun to wear a DNR bracelet. And so he has made some choices that are, I'm sure, very difficult for him and his family. And so I ask that if you're a praying person, that you add them to your prayers and pray for peace with their decision. This week we had our chemotherapy, and what we learned was this was my 12th cycle. So that's considered kind of like a full round. And most patients actually don't make it through 12 cycles. They either have other underlying conditions that prevent them from making it all the way through the 12th cycle, or their body cannot handle it. And so we're very thankful that my body was able to handle it and that we could get all the way through 12 full cycles and still maintain a relatively good health. And what that means going forward is that we're going to go on to a stronger regimen for our maintenance mode. In fact, we're only just going to reduce one drug from the cocktail that I received, and that drug is oxaliplatin. This is the drug that causes my neuropathy, and because it can create long-term side effects, we're going to remove that. The doctor, Tejani, has warned me that the symptoms of the numbness will get worse before it gets better, but we're going to remove that. We'll keep the rest of the drugs and be able to continue that every other week. So if you remember back in my episode 22 where I talked about the chemo experience, I mixed up my drugs a little bit, so I just want to clarify that the oxaliplatin is a 2-hour infusion that occurs during my infusion at the cancer center. And Adrucil is the drug that is delivered in the pump for 46 hours. That's the last one I receive. And so going forward, we shouldn't have to spend as much time in the infusion center on Thursdays, but I still will have the pump going forward. And that's okay because we're going to still aggressively fight this. The other thing that we talked about is, remember, we wanted to see no growth, no spreading, and shrinkage of the tumor. We continue to see no growth, we continue to see no spreading, but we don't see the shrinkage of the tumor. And in talking with Dr. Tejani this week, one of the things that could be happening is we're actually are killing off the cancer cells, but the mass just isn't shrinking. But in given some time, we could begin to see some shrinkage. And so we have our next CT scan for later in March. And then in April or early May, instead of doing a CT scan, we'll probably do a PET scan. And what the PET scan will allow us to do is see how much of that mass is kind of still alive and is absorbing, right? And so that's going to help us understand if I have a mass that has a lot of dead tissue or dead cancer tissue, then that'll be a really good sign for us, right? That everything's moving in the right direction. And eventually that should go away, or maybe we have to go in and surgically remove it. But the good news is we're not seeing the spread. And so we're hopeful that the cancer is actually dying off. It's just not shrinking what we're seeing. So that's a basic update for this week. For my gratitude moment, I am grateful that my body has held up over the last 12 cycles. And while I would love to say I'm done with cancer and we're moving on, I'm grateful that my body has held up and that I'm able to go with a stronger maintenance mode to be able to continue to fight this cancer with everything we have so that I can come out the other side. And so that's my gratitude moment for this week, is the health that I've been able to maintain, be able to maintain my weight, and be able to stay healthy enough to continue with the chemotherapy, the immunotherapy, and the clinical trial drug. My name's Craig. I'm with One Man's Cancer Journey, and I wish for you a blessed week.